Hello, and good evening, wonderful friends, Facebook family. And it's 8:10, and I had promised that I would keep time. If it's 8:10 and our video is supposed to start at 8:10, we surely have to start at 8:10. We cannot start any later than that. I have given my video a lot of advertisement. I have really pushed the agenda that I want us to discuss today, because I feel that there are a lot of people who are out there who have been told they have chronic lifelong conditions or autoimmune conditions, and maybe they don't know what they are supposed to do other than resign themselves to the fate of what the doctors told them. Now, today our topic of discussion is what we call autoimmune conditions. All right, we are discussing autoimmune conditions. And I know the first thing you're going to ask is, Munge, what is an autoimmune condition? If you're there and you can hear me, you can just put on a wave or a comment and just say, Munge, I can hear you. What is an autoimmune condition? And the first thing I would like for us to note is, when you go to your doctor and your doctor says you have an autoimmune condition, the first thing that you may be met with is the shocking exclamation by your doctor, John, if you can hear me, I know you can put the thumbs up and just put the comment. John Mungai, if you can hear me, please just give me the thumbs up or just give me a comment. I can hear you. I just want to be sure that everything is fine. We have just started. So what I'm doing is I am now getting to define what an autoimmune condition is. Our talk today is about autoimmune conditions. And I was just saying that when you go to a doctor and they diagnose you with an autoimmune condition, the first thing that is surprising is that the doctor will tell you, the researcher or the doctor will tell you, thank you, John says, yes, sir, thank you, my brother. They will tell you, we do not know what causes the autoimmune condition that you are suffering from. Now, you have gone to a doctor, you have a condition that you're battling with, and then the doctor tells you, the professor, the very learned doctor or the researcher tells you, we do not know the exact cause of what, Cynthia says, can hear you well, thank you. We do not know the exact cause of what you're going through right now. So the autoimmune condition you're going through, the doctor has identified it, but they don't know the cause of that. So that is even more confusing for you, because you're going to be given drugs, you're going to be given a prescription, but you don't know the root cause of what it is that that is making you suffer. Thank you. Kibet is saying, I can hear you. Thank you, sir. So let me define for you autoimmune condition. Autoimmune condition is any of the over 80, so there are over 80 conditions in which your immune system systematically and mistakenly attacks your body. So your immune system, which you're trying to build, we keep on hearing about, build your immunity. They tell us, take vitamin C to build your immunity. Now that same immunity that you're building is the one that goes ahead and gets confused and attacks your body. So it attacks your cells, tissues, and organs in your body. So the body's immune system, all right, sees healthy cells in your body as the enemy and goes ahead to attack these cells. Now, this is the very, very strange paradox that we are trying to unravel today. Why would your body get confused and attack seemingly healthy cells? So now we are going to get into possible causes of autoimmunity. Remember, your doctor has already told you, we don't know what causes autoimmunity. But from the research I have done, I keep telling you on my page that I research from 2 local doctors, okay? I research from 2 local doctors, Dr. Katambo and Dr. Gadirimo, and then I research from 5. How many? 5 international doctors. So when I come to Facebook Live or to write anything on my page, I never write wanting to put anybody in the way of harm. I am always writing these things because I want you to get better, because I myself have gotten better and I want you to get better. So the research I do is based on doctors who are open-minded enough to look at alternative ways of treating chronic conditions, chronic in quotes. So now let's look at possible causes of autoimmunity. The first possible cause of autoimmunity could be a bacteria or virus that triggers changes that confuse the immune system. So a bacteria or a virus will bring in a change that will confuse the immune system. The second one are drugs you could be taking. So you could be on prescription drugs from your doctor, and these drugs are theorized again that they are the ones that cause the confusion in your immunity. The third one is a genetic disorder. We find that in some communities, in some races, in some ethnic groups, they have higher predisposition to autoimmune conditions than other communities, all right? And then the other one that is very, very interesting that I want us to seriously consider are what we call plant toxins. Now, I'll say this, and I will let you know that this is based on research I have done on what doctors do, right? And if you want more information, we can always sit and have tea, and I'll give you more information. Remember, I cannot squeeze all the information I have in my notebook in 45 minutes. So I'll have to be very brief, very precise, and try to give you as much information as possible, but ensure that you do not get confused. Now, when we talk about plant toxins as possible causes of autoimmunity, the first plant toxin we have are called phytates. Now, phytates are antioxidant compounds found in whole grains, nuts, seeds, and legumes. Are we together? Phytates are found in whole grains, nuts, seeds, and legumes. And you can see the common denominator here is that this kind of foods are difficult to digest. They bind to certain dietary minerals such as zinc, iron, manganese, and calcium, and slow down absorption in your body. Now, when the absorption is slowed down, obviously, it also means there's something that is going to be happening in your belly. So that could be one possible cause of autoimmune conditions. Remember, we defined autoimmune condition as what? As the body mistakenly attacking healthy cells because the immune system has seen those healthy cells as the enemy. Part 2 of plant toxins, it's getting even more interesting, are what we call lectins. Now, lectins are proteins that bind to carbohydrates. So here we have proteins that are binding to carbohydrates, and they resist being broken down in the gut. So you start having gut issues. You've heard of so many people who, when they eat wheat, they have a problem with digestion. Examples are lentils, tomatoes, potatoes, peppers, and nightshades. Others are vegetables, beans, peanuts, chickpeas, peanut butter, peanut oil, goji berries. All these are lectins. So we find that lectins, once again, are proteins that bind to carbohydrates, and they resist being broken down in the gut. So you're going to have digestive problems because of eating lectins. Now, this is based on a research that I have done from various doctors, as I had mentioned earlier. Now, the third interesting point on plant toxins are oxalates. And you'll hear some people saying, I went to the doctor and he examined me and he told me to stop taking spinach. Oxalates are anion compounds found in certain foods. They are also produced as a waste from the body. Now, when oxalate levels are high in your body, they bind to calcium and form what we call kidney stones. Kidney stones are very painful. If any man can be honest enough to tell you if he has had kidney stones, that is the closest a man will ever get to giving birth. That is the same amount of pain a man goes through, that pain that the man goes through is the same amount of pain that a woman would go through when she's giving birth. So kidney stones are no joke, and they are caused by oxalates. Are we together? Now this will mean that the body will not absorb beneficial nutrients in one's digestive tract. Now the examples of oxalates, because this is where it's getting even more interesting. Things like spinach, soy. I see a lot of people like doing marination with soy. Almonds, interesting. If you have an issue of oxalates, you need to moderate on your almonds. Potatoes, beans, raspberries. Note that beans are being noted in all these three categories of phytates, lectins, and oxalates. Now we had beans, raspberries, dates, sweet potatoes, black tea, wheat, oranges, beer, coffee, very interesting, even coffee, chocolate. Now, what is the treatment for autoimmune disease? How do we go about treating? Now, you don't know the cause of the disease, but you want to treat it. So you're giving pills. All right? Let's go ahead and see what our doctors are saying. And I'm talking about doctors with an open enough mind to be able to look at alternative ways of treating these autoimmune diseases. Because myself, I've been struggling with diabetes for over 25 years. Had I not gone keto, I would not look the way I'm looking right now. You've seen my photos. I've posted them on Facebook. Me, I'm not ashamed of posting my photos. I post. I'm no longer diabetic. My diabetic condition has been reversed. Whatever issues I may be battling here and there, like insulin resistance, they are not as severe as before. Supposing I was not open-minded enough, or my doctors who put me on keto, 2 doctors, were not open-minded enough to consider alternative methods of treating so-called chronic ailments, where would I be today? I always ask myself. Maybe I would have been a statistic of a COVID-19 patient who died who was also diabetic. God forbid. But thank God I'm healthy. I eat well. I eat very well. I hydrate enough. I take more than about 3 liters of water daily. I do a lot of bone broth. Okay? I'm very, very careful about what I eat, and I exercise a lot. So alternative ways to treat chronic autoimmune diseases. Now, because most doctors don't even know the cause of autoimmune disease, they may want to put you on drugs for the rest of your life and just hope that everything will be fine. Now, we are going to look at what we call anecdotal reports. I want to clarify something here. I am not a doctor. Mimi sio daktari. Even if you go to the medical practitioners board, my name is not there. I am just somebody who is passionate about treating lifestyle intervention methods for treating chronic diseases. Chronic in quotes. So I'm very, very passionate about seeing people getting better. If you have hypertension, high blood pressure, diabetes, type 1 diabetes, Crohn's disease, Graves' disease, all these ailments, they are methods of intervention that we need to be open-minded enough to explore. Now, when I talk of an anecdotal report, this means, anecdotal means, say for example, your doctor is Dr. Aluoch. Dr. Aluoch receives a report from 2 people that they have been suffering from lupus. But ever since they went on a low carbohydrate diet, the lupus seems to have gone into remission. There is no scientific evidence to back what these 2 patients are claiming, that they have gone on remission, they have been on lupus, they have lupus, they have gone on remission by going on a low carbohydrate or 0 carbohydrate diet, and then 3 or 4 other patients come to Dr. Aluoch and say the same thing. Now, Dr. Aluoch would be somebody very inhuman, or just, I would wonder why he would keep quiet about such a thing and not sit down and ask himself, hey, 6 of my patients have come to me who have been suffering from lupus, and they are saying ever since they went into a low carbohydrate diet, they have gone into remission. The flare-ups have stopped. Say you have Graves' disease or celiac disease. You have gone on a low carbohydrate diet, the flare-ups have stopped. That is what we call an anecdotal report. The patient is coming to you as the doctor and telling you, I went on a low carbohydrate diet and now it has gone into remission. I don't have such serious flare-ups as I used to have before. The doctor will take down those notes and sit with his colleague somewhere, compare notes and say, I think this is something we need to look into. So there is no scientific research to back that up, but that is what we call anecdotal reports. And soon you'll find tens of hundreds, thousands of patients reporting that they are going into remission because they have gone on a certain type of diet. Now, I want you to be open-minded enough to explore these diets. I told you I'm not a doctor, and I'll get to the point of how we can explore these diets together. I'll give you the roadmap. So, there is no non-meaningful scientific research that shows that if you have an autoimmune condition, you can benefit by being on a specific diet, but we have anecdotal reports from the patients themselves. We have anecdotal reports and not controlled scientific research. A lot of these reports have shown that patients with autoimmune conditions who went on low-carb diet benefited greatly. Some even went ahead and reversed their conditions. So why would we ignore anecdotal reports that seem to make some people better? Examples of autoimmune conditions. I want us to get to those examples. Number one, rheumatoid arthritis. Okay, I'm giving examples, 10 examples of autoimmune conditions. Remember, there are 80. We only have 45 minutes. We do not have time to go through all the 80. I will be very brief and summarize these 10 conditions and then give you the roadmap of what it is I'm suggesting for you. Number one, rheumatoid arthritis. What do we define that as? Inflammatory disease causing painful swelling mainly in the joints of the body. Remember, we had said an autoimmune condition is where the body mistakenly sees healthy cells as the enemy and attacks them. So in rheumatoid arthritis, it is an inflammation that will cause painful swelling mainly in the joints, in the body. Number two, lupus. Now remember, these are diseases, I'm concentrating on 10 diseases where the doctors who I read and research from have indicated anecdotal reports that by going on specific kind of diets, they have been able to reverse or go into remission of these illnesses they've been suffering from. So this still needs more research, but they are reports from the patients. But remember, as I said before, no specific scientific research has been done, but this is what the patients themselves have come up to tell the doctors. So let's get that very, very clear. So number two, lupus, inflammatory disease where the immune system attacks tissues and organs, including the joints, the skin, kidneys, blood cells, brain, heart, and lungs. So even with lupus, there have been anecdotal reports, okay? Anecdotal reports that lupus patients can go into remission by getting onto a certain kind of diet. But remember this, you would need a doctor intervention and a doctor who is open-minded enough to take you through the steps that are required. Let's get this right. Number three, Crohn's disease. So inflammatory bowel disease, very, very uncomfortable. Pain in the abdomen, severe diarrhea, fatigue, weight loss, malnutrition, inflammation of the digestive tract. This is another autoimmune disease. Number four, psoriasis. This is an inflammation again. It is an autoimmune disease leading to skin disease. So your skin has issues, okay? It is a chronic disease where you get red, itchy, scaly patches on your skin, on your knees, on elbows, on your trunk, and on your scalp. Again, an autoimmune disease with anecdotal reports of remission, So I will give you the roadmap. Number 5, ulcerative colitis, another inflammatory bowel disease. What do we have here? Inflammation and ulcers in the digestive tract affects the innermost lining of the large intestine or the colon and the rectum, causes very severe pain. That is an IBD disease. Number 6, celiac disease, inflammatory response to eating gluten. A lot of people nowadays have gluten intolerance. They eat bread with wheat, tumbo yao inafura mara moja, their stomach swells. Very, very uncomfortable. So if you eat wheat, barley or rye, the inflammation will be triggered in the small intestine. Number 7, pernicious anemia. That is a decrease in red blood cells in your body. So the body cannot absorb enough vitamin B12. So you have weakened stomach lining. And what happens? You have fatigue, weakness. It is also known as atrophic gastritis. Okay? And this one is dangerous because it can lead to nerve issues. When you have a deficiency of B12, you need to be very, very careful because you're going to have nerve issues as well. All right? Other than having the fatigue and the weakness. Number 8, Graves' disease. Thank you, Jerry. You said you can hear me loud and clear. Thank you. Graves' disease is about overproduction of the thyroid hormones, thyroid. A lot of women above 40 are affected by this disease mainly. It is also known as hyperthyroidism. It can lead to heart problems, weak, brittle bones. It is common in women above 40 years of age. It causes tremors on the hands or the fingers. It brings about heat sensitivity, increase in perspiration, warm, moist skin. It brings about weight loss, enlarged thyroid gland, and change in your menstrual cycle. So if you suspect you have any of these conditions I have mentioned, remember these are just the signs and symptoms we are giving. You need to go to a good doctor, and I'll send you to good doctors. You WhatsApp me. I always give my number. I prefer WhatsApp. You WhatsApp me. We have a meeting, we discuss, we have coffee. I will send you to the right doctor who will do the diagnosis for you, and then we'll have a roadmap for you for your healing. Multiple sclerosis, a disabling disease of the brain and spinal cord, that is the central nervous system, that has the following signs: very debilitating, vision problems, eye issues, tingling and numbness. There are some people you'll hear saying, nasikia kama stima inapita kwa mguu. They have a lot of tingling. They have pains, they have spasms, weakness, fatigue, balance issues. You see someone losing their balance when they are walking. Are we together? They have dizziness. They have bladder issues. They cannot control their bladder. They have sexual dysfunction issues. So this is serious. And they have cognitive problems, cognition, things to do with the brain. Now, autoimmune conditions also bring about fatigue and behavioral abnormalities, which also encompass things like depression, depression-like symptoms. So you'll find a lot of people with MS, multiple sclerosis, Graves' disease, Crohn's disease, psoriasis, lupus, and all these other illnesses. Even type 1 diabetes is an autoimmune disease. You'll find that they may have depression as well. So when you're treating the depression, you need to address the root of that depression, because a lot of people with these autoimmune conditions may also develop mental health issues. And we need to address that. Are we together? Now, there is a lot of reports on a different condition which is not an autoimmune condition. Note this, it is not an autoimmune condition, but it has symptoms similar to the inflammatory bowel disease. Now, it is called irritable bowel symptoms, IBS. A lot of people have this. A lot of people have written to me saying, Munge, we love what you're doing. We love the way you're coaching us. We love the way you cook. We love the way you show us things on Facebook. I think I'm going through IBS, irritable bowel symptoms. How can I get better? What do you propose for me? So IBS is different from IBD. IBD is a disease. IBS is a cluster of symptoms. So it is not to be confused with inflammatory bowel disease. However, the symptoms are similar. It is not an autoimmune disease. It will bring about pain in the stomach. It will bring about wind. Watu wanashinda kufanya wakikula such kind of phenomena. Diarrhea, constipation. It will bring about bloating. But this can be well managed with diet. Now, I told you I'll give you a way forward and a roadmap. And I'm about to end my broadcast because I told you I don't want to take too much of your time. Now, the way forward is to see a doctor who is open-minded enough to note that certain foods do cause inflammation in our body systems, in our gut. Certain foods do cause inflammation. So telling you to eat everything in moderation, and maybe you're going through an autoimmune condition, or maybe you have a condition that requires you omit certain foods, is not helping you. You need proper investigation. You need to speak to a doctor who is aware about lifestyle diseases, about autoimmune conditions, and is open-minded enough to look at you, look at your symptoms, do every kind of test that is necessary to confirm what it is you're going through. If it is Crohn's disease, if it is ulcerative colitis, he confirms what disease you're going through and then prescribes, makes a roadmap for your treatment. And that treatment could include medication, or it could be in medication and diet, or diet alone. Now, those are the kind of doctors I love. Doctors who are willing to consider that food is actually medicine. Not a doctor who will sit behind his desk like this. And the same things he was taught 30 years ago in Russia, in medical school in Russia. I'm not saying medical schools in Russia are bad. Maybe he was taught in London or in US or China, wherever he went. The same things he was taught 30 years ago, he has never changed. He will even tell you saturated fats are bad. Says who? If they are bad, why hasn't he gone to do a research on the Maasai community? Why hasn't he gone to do a research on the Samburu who eat? Why has he not done that? Why is he just sitting behind his table with his hands folded like that, only writing a prescription and not willing to explore alternative diets for your healing? Remember, this is your life. You have the permission to seek for an alternative kind of opinion. If your doctor gives you one opinion, you have the right to seek an alternative doctor who is open, open to alternative methods of treating lifestyle disease and autoimmune conditions, because that might actually save you. How many people have died of lupus? How many? You know them. I don't want to start mentioning names. How many people are suffering with lupus today? And lupus is something that there are anecdotal reports that this disease, which is deadly, can actually be treated with diet. I'm not saying that you come directly to me, I give you a diet for lupus. No, I'm saying first we go to the doctor. Okay? I like what John is saying. This is good. We live in this body. We have to take care of it. Absolutely, John. Absolutely. I'm saying first I will take you to my two doctors who are very open to treating you with lifestyle intervention methods. You see them. They come up with a roadmap for your healing and treatment. Now, if they approve that you can get onto a low carbohydrate or a zero carb diet, now we sit together and I will coach you on what to do and what not to do. I will even teach you in your house how to cook those meals, because I want you to get better. So for me, I'm a coach and I'm a chef. I love cooking. I love being in the kitchen. Oh, I don't like that word cooking, because when I say cooking, people start disrespecting me. I don't want to be disrespected. I am a chef. I will teach you how to prepare meals that will make you better. But remember, I have said I will take you to one of my two doctors, or both of them, whichever doctor you will choose, because I don't want you to say I am biased, I'm only taking you to Dr. So-and-so. No, I will let you choose. They have both attended to me. And the reason why I am well today, the reason why the newspapers are running after me, the Standard is the Standard. Here we go. These are my articles, full page. Isn't God good? God has given me full page advertisements on the local dailies. This is the Business Daily. They have featured me. The Standard has featured me. BBC has featured me. NTV has featured me. So what I'm doing is not nonsense. I'm not a quack. And every time we do these interviews with the press, my doctors are interviewed as well. My doctors will attend to you. They will give you a roadmap for your healing, and then I will coach you. That is the plan. So we see a doctor who treats lifestyle disease. Very informative presentation. Thanks a lot, Munge. Thank you, Kibet, my brother. The doctor will be open-minded enough to note that diet can also heal you. The doctor will authorize and say, yes, patient X can get onto low carbohydrate diet. Then I will coach you on that diet. I will teach you everything there is to know. I have over 200 recipes I will teach you on. Keto, zero carb, whatever you want, I will coach you. But I want us to do things the right way. I don't want you to say, Munge has been teaching keto. I went to his page. I saw his one meal. Now I am on keto. Where? I am not with you. I will deny I even know you. You cannot get onto keto without knowing what you're doing. Keto is good, but if you do it the wrong way, it will harm you. You will land in hospital, and you will have no one to blame but yourself. Do keto or do a low carbohydrate diet the right way. Get doctor authorization, and I will stand with that. If you come to me for shortcuts, telling me I just want a meal plan, I will tell you I don't even want that money of yours for consultation or for buying me coffee. I don't want. I want to work with people who want long term. You want to get better. These diseases can kill you. They can destroy you. These diseases are dangerous. Diabetes is a dangerous disease. Hypertension, blood pressure. We are going to be talking about these diseases. Some of you are playing around with your lives. These are dangerous diseases, and you want to take shortcuts. I'm not going to be responsible for any shortcuts you are taking. I have been on keto for 3 years. I have steadily lost 19 kgs over the years. I didn't rush to lose, 20 kilos in 4 months. Watu wanakujanga, they call me, they say, Munge, I want to lose these 4 kilos in 4 months. You want a magician? I'm not a magician. I will not do those things. I will never, and I swore to God, as I pray, I will never put anybody at harm. Ati juu anataka ku lose weight. We have to do things the right way. Those things of losing 10 kgs in 10 days, and then all of it comes back. Me, I don't want to coach somebody. Then you go, you start talking bad about me. You go to another coach. Unasema Munge doesn't know what he's doing. Unaenda kwa huyo coach mwingine. Then you go to a juicing center. There are juicing centers all over. You stay there for 2 weeks. Unaruka, unaenda kwa coach mwingine. Wewe mwenyewe ndio uko na shida. You have a problem. You don't want to stick to what you're being told, and you are not disciplined. I am not going to accept to be working with people who are not serious about their life. And that's why I've told you, step 1, tutaenda na wewe kwa daktari. Hata nitakushika mkono hivi. I will take you to their 2 offices. Wako hapo karibu na Kenyatta Hospital. They are very nice offices and they are very good doctors. Na wako na akili, na wamesoma. These are very intelligent doctors. Hata wanakaanga boardroom. They sit in a boardroom with kina Dr. Silverstein of Nairobi Hospital. So don't say that this is a small... No, these doctors know what they are doing. And we want you to get better. Now, wengine, when you hear what I say, you're always seeing me on Facebook. Now, some of you are not taking what I'm saying seriously. Munasema you don't have time for dieting or for coaching, ama for making keto meal plans, ama exercise. Lakini Friday na kuona umepost singleton. Singleton is 18,000. Well, you can afford, hata unaweka hapo umepost 3, 54,000 shillings, my brother. You can afford 3 singletons, na hiyo umenunua nyama, na uko na tuwasichana hapo unawatumia M-Pesa. And you don't give a fuck about your health. You don't care. Sorry for that language. You don't care for your language. You don't care for your health. Sasa ni nini itakufanya? What will make you get serious about your health? What? What will make you decide that mimi nataka kuwa kama Munge? Munge alikuwa ameambiwa atakufa na shida ya liver. I've been told I'll die because of my liver. Today I'm healthy. I was told I'll die by 45. I'm alive today. Sasa, I want you to get serious about your health. I want to coach you. It's 8:45. We have only about we have very very few minutes. It's 8:45. I want to finish early because I want to give you enough time to think about what I've told you. And I also want you to go and watch the news. I know a lot of you Kenyans like watching the news. Elections are coming. But I want to say one thing. Before COVID came, we never knew there would be COVID. Now, do we know if there is another COVID coming? We don't know if there is COVID-22, COVID-23. How do we know? How many prophets? I believe in prophets. One of the prophets I believe in is called Emmanuel Makandiwa. And I honor men of God. I love men of God. I love them so much. How many prophets have come up to say whether there will be another COVID? So start working on your diet. And it has been proven, a doctor will even tell you, those guys who are doing something about their diet and their health, they are getting over the COVID symptoms faster. Sasa wewe usiende kuchokoza kifo, ati you'll eat what you want. You start saying nonsense, tutapewa mwili mpya binguni. Where? Unataka kukufa? You want to die of lifestyle disease? Mambo ya mwili mpya tutapewa binguni, tafadhali muache. Be careful about your weight. Be very, very careful. As you have seen, there are over 80 conditions, over 40 that are related to weight. Weight issues. Sasa ukisema ati mimi na body shame, kuna watu wanashindaga page yangu. Me, I'm not body shaming. You know me, I'm open guy. Me, I was fat. I was sick. Hata umeona picha zangu, I was looking so bad. Hata I don't even know kama hao mademu walikuwa wananikubali kwa nini. Because I was looking horrible. Hata saa hii nikikuwa nakatia dem nimuoneshe picha yangu, how I was looking, she'll be like, Aki Washira babe, don't show anyone those photos. Ulikuwa unakaa mbaya. Hati anasema yeye mwenyewe anakubali, used to look bad. Now I look better. Look at me. I look handsome. I look well. Nimepona. Sina magonjwa. Silali ovyo ovyo. Ati nimekula lunch. I start sleeping. I'm not like that anymore. I want you to get better. So I've given you the way forward. Kama una suspect you or anybody in your family has any of those 10 autoimmune conditions, remember there are 80. There are many. Ziko mingi. Tafadhali enda ufanye research kwa Google. Go and research on autoimmune conditions. Ukiona ni kama any of those conditions wewe uko nayo, ama anyone in your family ako nayo, kindly, I always give my number on Facebook. There is no single post I don't put and don't put my number. So don't tell me you don't have my number. Call me, WhatsApp me, tell me, Munge, my name is so and so. Sorry, I saw your Facebook live video. I suspect I have an autoimmune disease. Or I suspect my brother has an autoimmune disease. How can you assist us? We are going to take that patient to see one of my 2 doctors. They will be attended to, and if they authorize, wakikubali tuende low carbohydrate, tutaanza coaching immediately. But we are not going to start coaching before daktari akubali. Kama daktari hajakubali, we cannot start. And there is a good reason why. Some of you right now are on taking prescription medication. Low carbohydrate cannot harm you per se. But kama unachukua if you are taking medication and then we get low carbohydrate, what may happen is it may counteract and it may give you very severe side effects. For example, kama wewe uko na hypertension. If you have hypertension and then you take garlic, I always use this example, it will lower your blood pressure. Are we together? So if it's lowering the blood pressure too much, it means that medication ya blood pressure bado unakunywa, you might need to reduce the dosage with a doctor ama utoe. Understand what I'm telling you. I am not fighting with any doctor. I work with doctors. I always send the clients coming to me, I always send them to my doctors. I have 2 doctors. Very, very sane doctors. Very intelligent doctors. And I'll always work with them. God bless you so much. I love you. I'm finishing the live broadcast now. I want people to get better. My aim is to see as many Kenyans as possible get over obesity. If we can do away with obesity, we'll do away with so many illnesses. Hizo obituary tunaonaga kwa gazeti. So and so died of cancer. So and so died of hypertension. Died of diabetes. We are going to have less cases of that. People are going to become better. Watu wapone. watu wakue healthy and fit. I want to start a training camp where I'm going to be having diet now. Naleta watu kwa training camp na wafundisha mambo ya diet kabisa. Tunaenda mahali hiking, we do tents there, a diet camp for like a month. Unakuja unasahau mambo ya everything else. We do diet and we do fitness and exercise, we hike, we climb mountains. By the end of that 1 month unarudi nyumbani unasema, wow, thank God for Munge. Thank God for the kind of vision that he has. Because my vision for this country ni tumalize obesity na tumalize hizi magonjwa zote. These diseases associated with obesity that are so horrible. We have lost so many people because of these illnesses. Even certain cancers. The onset of these cancers is obesity. So I have told you, let food be thy medicine. Chakula iwe dawa yako. Let food be your medicine. Note this, I am not asking anyone not to take medicine. Me, I'm not a doctor. The person who can remove medication from you is any of the doctors I send you to. So I have a plan. I'll work with the doctors. I have sent so many patients or clients to the doctors. They will help us. They will assist us. And you will get better, because you must get better. You cannot die of lupus. You cannot die of any of these other diseases, rheumatoid arthritis, or any of these other diseases, whatever it is you may be going through. You're not going to die of diabetes, okay? You're not going to die of BP. No, you are going to get better. God wants you better. God does not want people suffering and sick the way people are suffering. Time is up. I have to end. I want you to go and watch the news. I love you all. I will have another live video next week. I will tell you what the topic will be. I will tell you which day the video will be, because I have to prepare. I will try the much I can to do 2 videos every week. But if I can't, the minimum shall be 1 video per week. I promise you that my mission shall not be thwarted. The mission is on forward gear. The mission has engaged to move ahead and get people better. Just the same way I am better today. And I am better because God gave me a second chance. And I know God is also giving somebody here listening, or 10 or 15 other people, a second chance. So don't play around with your health. Take it seriously. Don't budget for useless things. I used to drink so heavily. I used to go and look for peddlers, to do weird things. I haven't touched alcohol in the longest time. An occasional glass of wine here and there, but I don't do alcohol anymore. I am focused on my health. I want you to get better. I know some of you are scared of being told to stop alcohol when you come on to low-carb diet. We're going to moderate the amount of alcohol you'll take, and we'll guide you on which alcohol you can drink so that you can still be healthy. So God bless you so much. I love you. We shall meet again next week. I will prepare. I will tell you what topic, because there are about 7 topics I'll be covering. I'll also be covering an interesting topic. Is HIV worse than diabetes? Somebody asked me that question. I was shocked. I didn't know how to answer her. There is also a topic on keto and low carbohydrate diets. There's also a topic on there's also a topic on other illnesses related to other lifestyle disease illnesses. We are going to be having several other discussions, even on blood pressure. Okay, so on diabetes, okay, type 1 and type 2, and the differences between the 2 types of diabetes, plus many other conditions that we shall be discussing, because I want people to get better. If you have any questions regarding the live video, kindly WhatsApp me. Sometimes it becomes difficult to go through Messenger, but WhatsApp is better. 0700 is my number, 000 797. That's 0700 000 797. I'll edit the live video and put a small comment there, and then I will put my number so that you can call me or WhatsApp me in the morning, and we can talk. We can have coffee. We can have a Zoom call if you're outside the country, and we can talk, because I want you to be better. So remember, I coach on weight loss. I also coach on keto. I also coach on iChef. I can teach you how to chef. And I also guide you if you are going about lifestyle disease reversal. But remember, we have to start with the doctor and the doctor's authorization, and then I will coach you, because I myself have gone through the same. So God bless you. Thank you. My live broadcast has come to an end. Exactly 45 minutes. Thank you, and see you next.